Is doing enough to rein in quacks in the medical profession? That's what we're discussing tonight on The Big Question. Let's cross over to Hussein Mohammed for details on that discussion.
Right, and we'll try and answer that question from what you're saying on 22422 on Twitter using the hashtag The Big Question. We have Kenya Medical Practitioners Dentist Board CEO, Daniel Yumbia. I said that right? KMPDB, it's a very long name. And Professor Kiama Wangai, a medical doctor and lawyer who's trying to help us discuss this. Thank you so much, both of you, for making time for The Big Question tonight. Let's take a look first at what you're saying on Twitter. Guy Shingai, they are not doing a thing. In estates, quacks are roaming freely, and the authorities know that. Agri Muyila, illegal medical dens operate in full glare of the public. Eric Ogi, authorities have done enough. As a society, we have our part to play by reporting suspect clinics. And George Gunning blamed the deep-rooted corruption and underpayment of those in authority. On 22422, somebody says it's unprofessional and bad governance for the board to purport to carry out inspections. This is a full-time job. Board members work elsewhere and don't have time. Their job is policy directions and enforcement arising from independent inspections. The board must also take responsibility for poor governance. And Moses in Mumia says the quack, that is Mugo Wairimu, should have been solved by the county and sub-county health management teams. The medical board has a small team that cannot take care of all parts of the country. Keep talking to us on 22422 on Twitter using the hashtag The Big Question. I'll start with you, Daniel Yumbia, CEO KMPDB. I'll go straight to the point because of time. From the board, we've had Mugo was arrested. He had no license, and the facility actually had no license to operate. How come he was operating then? He was arrested in June or July? How come he was operating until then?
Thank you, Hussein. I think as a board, we are doing our best within the environment that we operate on. We do carry out joint inspections together with other health regulatory boards and councils. This is the Nursing Council of Kenya, the Clinical Officers Council, the Laboratory Board, and the Pharmacy and Poisons Board, besides the Public Health Board. Initially, the board was doing these inspections alone. And we discovered the quacks were taking advantage. You walk into a clinic, they say, we are licensed by the Clinical Officers Council. As the law stands now, all those regulatory authorities have the mandate to license health facilities. So the medical board comes in where we have institutional clinics and inpatient facilities. So any inpatient facility is licensed by the medical board. Any outpatient clinic can be licensed by those bodies. So we do license outpatient facilities which offer multiple services. Right. This includes the... in a list you gave us, I think it was in June or July, if you can confirm for me. Actually in June this year, 51 medical facilities that were supposed to be closed. This was from your board, right? One of the facilities there was that facility where Mugo Wairimu was practicing. Yet, June, July, August, we have this story now in September. Very good. I think that's where the details emerge. This was a joint inspection. I coordinate the entire inspection. As the CEO of the medical board.
Yes.
These inspections were led by the chairman of the Inspection and Licensing Committee of the medical board, Dr. Onyino Were. I had gotten information about facilities in that area which were operating without licenses. And I got the county government of Nairobi was represented by their public health officer, who accompanied my team to the facility. And Dr. Were went with police officers from Special Crime Prevention Unit. A joint venture unearthed this problem. Mugo was found in the clinic. He was arrested and taken to Kasarani police station, where he was booked by my officers. And he was supposed to be taken to court.
This is June.
This is June. And taken to court and be charged. The Kenyan law is to blame to some extent, because you get a person who has committed a crime, Prof will bear me witness, you taken to court, you don't say kamata, funga, weka ndani. You take to court, and this person is given a chance to defend themselves. Now, once they have been given the bond, what other responsibility do I have over that person?
Not the person, the medical facility. This is June. The medical facility was still operating.
I have closed the facility. I have taken the officer to the police station. I have ordered that he be taken to a court of law.
Right.
I am waiting to go and give evidence in court.
About that case?
He is given, whoever gave him the bond to get out of police cells, whoever gave him the court to get out of the courts, what instructions did they give? Did they give me a copy?
No, I don't know.
They didn't give me a copy.
Right, but the thing is,
we are all in it.
Okay, but the thing is, how come this medical facility still was in operation?
Exactly. If you look,
you haven't closed it after that. You say
no,
you
we
closed
closed
it. Okay, how is it that it was in operation?
If you look at my report, Hussein, the report is very clear. The county government of Nairobi is supposed to ensure compliance.
Not the board?
Once we have given orders, who is on the ground?
Okay. I want to bring in, I'll come back to that. I want to bring in Professor Kiama, but I want you to tell me first, what are your thoughts on this and whether we are doing enough? And ask the board whether they're doing enough.
Well, I'm picking it up from where Daniel has left. They seem to have been there. They seem to have done the inspection, and they know this was a bad clinic, and they made a decision to close it. And then Yumbia returns back to his office. What he's probably not telling you is that this joint inspection is not a continuous thing.
Right.
So it's assembled, and then it takes a bit of time to assemble it again. Now, what is lacking is, even if you go to this facility and declare it that it needs to be closed, the facility, they are aware you will take long before you come back. So they will operate.
Yes.
So what you are lacking is that you have it's thin, the inspection team is thin. You need to decentralize it. For example, Yumbia in Nairobi cannot be expected to inspect all over the country. He's Yumbia, he means well. But then he's thin on staff. So you must decentralize this inspection at the counties, and it must be made regular.
Right.
Because the healthcare facilities are very many. Yumbia cannot be expected to be in Kilifi right now.
Right.
You don't know what's happening in Kilifi.
Right.
You don't know what's happening in Vihiga. That's the problem of the inspection.
Right.
On the issue he's raising about the police, them having booked this person, the police, and then they are released, we may not comment about it until the facts are quite out. Because everyone has a right to a bond. You are presumed innocent until proven guilty. So that even if the public indicts you so much, you must be taken to a court of law.
Okay. Let me get this then from you,
Daniel. Just call me Daniel.
Daniel. I'll just call you Daniel. All right. Thank you for that. How long does it take? You've done an inspection, like you did an inspection in June, you say. That was in Nairobi. Before that, when was such an inspection carried out?
The other inspection was carried out in Mombasa.
I'm talking about Nairobi, for instance.
The previous inspections in Nairobi were done towards the end of last year.
Towards the end of last year?
Yes.
So, after you did this inspection that weeded out some of these, facilities that should be closed, not only Mugo or Irimus, because there are about 51 you talked about, how long does it take before you do another one?
For us to do a follow-up inspection, within a period of 4 months, we should have done a follow-up to ensure that...
4 months?
Yeah, to ensure that there is compliance, because as Prof was trying to say, we also have challenges, and these challenges are known to you and me, that the board is on oversight, and we coordinate the other boards and councils for the inspections. And once we go to the ground, initially we used to be the boards alone, and people would even close and they make calls, and we don't even inspect. Now we have changed tact and involved the county government. If there is no county, we are not even inspecting 2 counts at a go. We go to a particular county, we finish that county together with the county executives for health or their representatives. And then from there, they will have known the facilities that have been closed. And then the report that we give is very clear. Actually, the report goes to the Director of Medical Services. And the Director of Medical Services forwards a copy to every county which we have inspected with the recommendations that kindly ensure enforcement, ensure compliance of those people that have closed down those facilities.
Right. But at the end of the day, you're supposed to license medical facilities. Don't you think then it's one thing if you go somewhere in June, first you said like in Nairobi for instance, maybe because of the challenges you have, and we'll talk about that later on. You did towards the end of last year. The next one was done in June. Immediately after June, one of the cases, we don't even know about the other 51, whether they were back in operation or not. But one of the cases here, for example, this from Mugo where he's operating, they went back to work until September. Good, how do you follow up? How do you just leave it like that?
Hussein, that is oversight inspection jointly. It does not mean that the Nursing Council did not inspect Nairobi County during that period of time. It does not mean that Clinical Officers Council did not inspect. It doesn't also mean that the Pharmacy and Poisons Board did inspect. When we go for joint inspections, is to verify the situation on the ground. And we give analysis and we give reports to specific boards and councils and say, we are finding many pharmacies open being run by unqualified persons, please identify. So our joint inspection is just like oversight to see what other boards are doing on their own and what the doctors are doing on their own. And that now informs the decision that we make other frequent inspections. By tomorrow, I will have conducted the Pharmacy and Poisons Board, because I do know they have officers in the field almost daily. And I'll also conduct the lab board, and I know they have also done another inspection after hours to see what is on the ground.
I don't know about your capacity, we'll come to that, but for most people and for most Kenyans, what they're looking at is, I don't know if it can be achieved, a country where you're talking about pharmacy board doing theirs daily. If this is something that can be every day, I don't know how hard or easy that is, because an unsuspecting Kenyan we'll just go to the clinic. He or she may not know whether this person is certified or whether this clinic has been licensed. Like, how does that happen? How can that happen?
Can I answer that question?
I think, Hussein, we must admit that inspection in this country on healthcare facilities is inadequate. There's no question about that. And Yumbia must admit. And he means well, like I said. What they need, the structure they are using is not good enough for this country. But another thing I wanted to say, Hussein, is this. Don't just look at the clinic called Prestige. And apart from the clinics that Yumbia regulates, there are other entry points for running clinics in this country. You have the traditional herbalists who also run these facilities. Apart from the one you're dealing with right now, those also cause a lot of damage. They are not regulated by Yumbia, and they are not regulated by anyone, because we do not have a very well organized regulation mechanism in the healthcare system. So we need to relook at the structure of regulation. If anyone who is going to be treated as a member of the public requires to be assured that quality control has been done on these facilities. The other thing also I would like to caution, it is wrong to in a blanket to condemn all the professions. Like you say, doctors are very bad, nurses are very bad, because you haven't quite identified whether this person is actually registered by these boards. So that it would be wrong to say Yumbia's board is wrong, because this is not a member of Yumbia's board, and this is not a member of the nursing board. So the first thing is that to know that this is a criminal. All right, who is harming people. So there are also other laws of the land that require also to be indicted. And we totally agree with that, Professor. This is a criminal. I mean, the procedures will be followed legally, but he was operating at a facility. The question is, how is this facility? How was he operating in a facility in this country? Yet this facility was apparently closed in June of this year.
The procedure of licensing facilities by the medical board and the Nursing Council and any other regulatory authority starts with the county government, starts with the county authorities. While I sit here in Nairobi, I'm not going to register a nursing home in Wajir without inspection report written by the county public health officer, giving me details saying, we have visited, this is what we have found, and the recommendations are that this needs to be registered. That is a pre-licensing inspection. That facility to open, there is somebody on the ground who should inspect and give a report. That has not been done. From Nairobi County. I'm not bashing them. That has not been done. We go and discover this is a facility operating. We close this facility. We say this person is not qualified to offer services here. We take him to a police station and we put him in. What else do you expect of me?
Why is that facility still open?
Because they have many avenues for registration.
You see, what I'm telling you is that Kiama has told you, I cannot be closing a facility and pitching tent there to wait for the fellow to open. And
okay, I want to look. I want you. I mean, it's a discussion we're having. What is the work of the work board? I want to look at some graphics here we have, and the role actually. Looking at the Medical Practitioners and Dentists Board, the Act really, what it says. There is 22. A person actually who seeks for a license and is not licensed by the board shall be guilty of an offence and liable to a fine not exceeding 10,000 shillings or to imprisonment for a term not exceeding 12 months or to both. I don't know if you find that very lenient or not. We'll come and talk about that and whether this thing should have been done earlier, maybe amending that law. Licenses for private practice. Now this is what the board does. Licenses shall be granted for a period of 1 year at a time, meaning every year you have to renew the license, and no premises may be habitually used for the purpose of private practice unless they are authorized for such by the board. That is why I'm saying, at the end of the day, this is a medical facility operating.
Very good, Hussein. I think you are reading Cap 253 alone. I want you to get the Nurses Act, the Clinical Officers Act, the Laboratory Board Act, and the Public Health Act. You realize and the Pharmacy and Poisons Board Act. They also have their act which gives them power to license facilities and the premises. Now, this one you're reading concerns a medical doctor, not a quack. It goes, the regulation that gives me power to register institutions is a Medical Practitioners Desk Board rules year 2000. That's when the amendment was done in this law to give the medical board power to license institutional clinics and medical centers and hospitals. Before then, when that regulation was made, we didn't have even power to license inpatient facilities. Okay. Now let me finish. Let me move this thread. We have realized the problems you are raising about license, inspection and jointly. What Professor Kiama should have said is that when we face this challenge, we had stakeholders consultation. A forum was constituted, and all the stakeholders came in, and they recommended establishment of a Health Professions Authority. Health Professions Authority as, among others, the function of the joint inspections. I must even say, at the fear of him taking me to court and fighting over this one person, that even the joint inspections are not anchored anywhere in law. They're not anchored anywhere in law.
The ones you're talking about?
The joint inspections are not anchored anywhere in law.
The ones you're talking about?
Exactly. This is what I'm telling you, at the risk of Kiama Wangai going to get clients.
But now, you've been talking about that.
Let me finish.
But you have been talking about.
Can I finish? Can I finish?
Okay, you'll finish. You will finish. Let me just make this point.
You cut me short.
Let me just make this point. You'll finish. I promise you, you'll finish. You're saying they're not anchored anywhere in law. This joint inspections. But you've been using that as a justification as to why we can't get this often everyday inspections. Now that question is confusing. Let me finish what I was saying. You have to answer me that question at some point. We'll still come back to it. I'll come back. Just finish your point. I'll come back to that. So when we realized this, we went to in the health bill, which is in Parliament now. I don't know which stage. The health bill establishes the Health Professions Authority, which now gives mandate for these joint inspections. Currently, as it's constituted, we operate under the authority of the Director of Medical Services. If you look at the powers conferred by law to the Director of Medical Services, he has the power to constitute that joint inspections. And that is the one that operates together. We coordinate as board. And when we arrest somebody, we charge them under various regulations. So if it's a nurse, we use the Nurses Act. If it's a quack, we can use the Cap 253, the section you are trying to show. And if it is a clinical officer, they have their regulation. The Pharmacy and Poisons were the same. But now we are saying, under the health bill, if it passes, and I pray that it passes very fast, we shall now have that legal mandate where this one will be regulated properly. So according to you then, this is a shared problem. It's everyone. It's a problem that these medical facilities may be operating and licensed. Not only it is not about the board really. I'm not even not the board alone, even the public. I'm even coming to the public. I have been chased away from Kibera. Have been chased away from Kawangware. In fact, a guy from Kawangware removed a gun. We were almost being shot. And you were there with cops?
we have security when we go. He wrestled with the policeman. The policeman has to wrestle him to get his gun.
Okay.
The teams have been threatened in Isli here. I mean, don't look at it like the joint inspection. If you go to somebody's clinic and you are closing it, it's not as simple as having a talk show on the TV.
Right.
It also calls for courage. Therefore,
having a talk show.
Yeah,
having a talk show is quite easy for you.
Easy for me now. Yeah.
I want to look at one more thing before we find a solution to this. Let's take a look at a letter here. This is. It's not that visible, but we can try and they'll read it for me, but you'll see it. This letter is, it's not quite visible. Can we read it?
Yes, in the press.
Right, this is a letter from the board. This is a victim. We did this story yesterday. Evelyn Omboy, who did this expose on Sunday, and this is where I'm talking about licensing of medical facilities, and where does the buck stop really, and the confusion that is here. This is a letter. A victim went and reported the case about Mugo Wairimu and something he did. A letter was written by the board, and the letter, the heading was, actually James Ndishu Mugo, I'm being read to because you can't read that letter very well, but you can see it. Right, trading at Prestige Healthcare at Githurai 44, that is Mugo Wairimu. All right. Now, you said in that letter as the board, we acknowledge receipt of your letter on the 12th of February. This is February 2015. And the contents whereof we have noted. Of course, the case he was talking about. So you said, we wish to advise that James Ndishu Mugo is not a registered with the Medical Practitioners Board. That is Mugo Wairimu. But further, the named health facility that he was operating on does not appear in our records. For further clarification, kindly contact the legal officer of the board. Now this case went like that. The legal officer, Eunice Moredi is the legal officer, written there, and the signature is there. This legal officer told them at the end of the day to go and seek assistance at the police station. This is Mugo again. In 2015, February 2015, this is when this letter was written. All this time again, still in operation. You did, and this is where I'm talking about how often can this be done. You did, let me just finish this point. You did a raid last year, towards the end of the year, you told me that. In February this happened. They've already raised this. You've already said this is not licensed and this is a quack. But it continues to operation. You did again another raid in June. You found it in operation. Then you closed it. It's still on operation.
Good. I think you're saying that's a very good question. It's a very good question in that I need to give you the background. To whom is that letter addressed to? Well, the letter must be addressed to a lawyer. What happens is that Kiyama Wangai knows very well that there is what we call official search. Somebody must have written to the board to ask the status.
Yes.
And today, we do that every time. And the people who do this are lawyers. And when you do a letter and do an official search, my legal officer has the mandate and the capacity to search and confirm. That is as far as that letter is concerned. That was an official search. Now, the person was advised, because they didn't even disclose to us the reasons why they were doing the search. Therefore, the search as it stands now, that letter was an official search. And therefore, why Murithi, the legal officer, directed them to conduct other health boards is that we have done that in the past. And we have said the person does not appear in the register, and then they appear in the register for the nursing council or the clinical officer's council. She was going an extra mile to assist the search, the person doing the search, that in the event that you are not satisfied this is not correct, you can still check with the other health regulatory boards where that name may be found.
But we did this story yesterday, and these are people who wanted action to be taken. It didn't happen. No, but my point is, it was not a complaint. It was a search. It was a complaint they lodged first because of what happened, and a search was done. But that's besides the point. My point is, this health facility, you did an inspection in last year. It was still in operation. In February, you had this letter, and you said this thing should not be in operation. It was in operation. You closed it again in June. Hussein, and it could not be the only one. No, I'm saying, Hussein, inspection that we did last year, we didn't go to that facility. I don't remember going. You didn't go to that facility? I don't remember. But in February, the board said this facility should not be there.
we saw the facility. The report I have is for June, 17th of June. In fact, I remember that very well. It was in the morning hours. Because it was the first facility that I directed my team to go for the first stop to be in that facility. And when they went there, that is what they found and they acted on it. Previously, we had not gone there.
Okay. To get clarity on this matter, we have to move this forward now as we wind up. To get clarity on this matter, what do you think should be the best way forward? Should we have, now you're talking about different councils and boards conducting different... Yes. What is the best way forward to handle this problem?
The best way forward to handle this problem, one is the health bill. Let the parliamentarians pass this bill. Let us constitute the Health Professions Authority, and we give the Health Professions Authority the mandate to conduct the joint inspections. Number two, in the meantime, stopgap measure, we need capacity. We need more inspectors in the field. We need resources. I'm not coming here to ask for resources, but we need capacity. We need resources to ensure that this...
You're not in every part of this country, obviously.
We are just here
in Nairobi only.
My board is composed of 15 members, and my secretariat is 21.
And that is it?
The inspection team is composed of 5 members, and then we get these 5 members and we borrow from the other boards and councils. So I get a team of about 21. So we are looking at capacity. Inspectors who should be reporting to the field every day, and they report to the board the challenges they get, and we move forward.
Right. As you wind up.
My take is this, Hussein. There is a wider thing we also did not address. There is corruption here. The licensing of some of these facilities have certain godfathers who protect them through these boards. That person who did all this has a protection from some office in this country. And as Yumbia's debate has come through, you realize that registration of a facility can come from various sources. You have the nurses can register, legal officer can register, Yumbia can register. You can have some Ministry of Culture and Social Services, other people can be registered at the county level. Now those persons are all not regulated because Yumbia will only regulate the doctors he has registered, and he cannot go and regulate someone he has not registered. Nursing Council will regulate their nurses. So the first, you asked in terms of way forward, one of the things is that you have to harmonize regulation of all these healthcare facilities, and they need to be classified and need to be harmonized, and it should be a concert of doing this. Number two, I agree with him, increase the inspectors. It cannot be a one-off event. This country is very big. The third thing that then must also be done is this. Once the health bill and the health authority has come into place, the regulation, the members of the public must have access to this information. The information you're having right now that these facilities required to have been registered, this should have been gazetted. It should be in the newspaper that we are now saying to the members of the public that the following prestige, whoever it is, we have ordered it to be closed. Because the members of the public then are like, therefore, what are we supposed to do? We are seeing healthcare facilities, and we go. You never told us it's not a good one. So all these boards, whenever they register and say this is not working, it's not good enough to say, I have an inspection on 17th of June. Who knows you did this? It's a public facility. It's serving the public. The public needs to know in an advert that this is not...
And this message here from Raphael in Nakuru saying, and actually asked, there are quacks in this area as well, but why do I have to pay, that is 2,000 shillings, when why is someone supposed to pay when they lodge a complaint at the board?
I think
why are the victims supposed to pay?
The complaint, the fee that we charge, to Nairobi, the fee that we charge for lodging a complaint is not about quacks. This is case of medical negligence, and we designed a form so that we can get people committed to the launching of their complaints. When we got cases from the media, and we went to investigate, and we reached a level of inquiry, and the lawyers came and stopped. They said there must be a genuine complainant. Now, we reached a level where we have a complaint, somebody has already written a letter, and we reach a level we need them to give a statement. They also declined to give a statement. So we were giving that as a form of commitment.
But however, would argue,
let me finish. However, we have power, the chairman of the board, the director of medical services, and even to some extent myself, we waive that 2,000 shillings when somebody wants to lodge a complaint. There is nobody we have turned away. We have refused to receive a complaint because they cannot afford.
But someone would argue you're almost punishing them twice, because somebody would not know, because somebody would say it's because of the negligence of the board that I got, you know, conned by a quack. Not
negligence of the board, because once you are... The issue of quacks we don't charge. Hussein, please get me straight.
You don't charge issues of quacks at all?
It's medical. No. In fact, I pay information. If I get somebody who is giving me information, I pay for their fare to lead the team to go to and discover that clinic which is being operated by a quack. That I've done in the past. But when somebody is lodging a case of medical negligence, we say show cause of commitment. If you cannot pay, the DMS, Director of Medical Services, can waive that fee. The chairman of the board can waive that fee. And I can at times also waive and report to the committee that this person cannot pay. And it has worked in the past.
All right, Daniel Yumbia, CEO, Kenya Medical Practitioners and Dentists Board, thank you so much for making time for the big question. And we wish the best for you going forward. And we are hoping all these challenges you're talking about, including funds and all that, will be addressed. And of course, Professor Kiama Wangai, medical doctor and lawyer, thank you so much for making time for the big question tonight. Keep talking to us on 22422 on Twitter using the hashtag The Big Question. We're back after this break.